Can I ask a question now?
Yes.
Okay.
Sorry.
No, it's okay. It's okay. I shouldn't have stopped you because in the start you said whenever somebody stop you from talking, then you have to go back to your first thing because I know these things. Okay, my question is like I'm from Pakistan, so I have a lot of people contacted me from your countries, from different countries. The problem over there is that they are not familiar with the processes you are just trying to teach us over here. You just try to mention over there. How much time it is required for those parents to access those things? Because whenever I talk to them, they said they are in the process of assessment. They are in the process of diagnosis. So we all know that early intervention is very important when we talk about speech impairment, when we talk about apyrexia, when we talk about behavioral problem, when we talk about even autism and other problems. It is very important to have start early intervention. It's important to understand the factors, and then we have to do certain things. But what is your opinion about that? How much time it is required for a parent who did or a family who did you could say immigration to the from other country to your countries? How much time they will take to access to all those codes and IEP meetings? What is your opinion about that?
Right.
So, Jordan, I have but I do want to
So it is from what I've seen of it is what I've seen of other countries coming to the USA to get more services. It really depends because I personally had a family come here. I believe they moved on July 5th. They have moved here, and it's now, getting to the month of October, and their child's IEP is absolutely still not right. So it is within the IEP process. It can honestly take quite a long time to get, the most appropriate IEP, and I'm talking about it can take a few months, it can take 6 months, it can take a year or years. So it's really different when it comes to that. And then when it comes to getting any side of outside services for a person that's trained in apraxia, it's very unlikely to find a person that has training in apraxia. So when people do find a person that's training in apraxia, they usually have a wait list. And what I've heard many of the time is that now the wait lists are going from 1 through 2 years. So it's my advice for any parents that are going to move to the USA and that are looking for their child services. I would definitely call in advance to try to get on any sort of wait list.
Okay.
I would try to do it a year prior to the child getting an IEP, because we want to get as much documentation as we could. So having them go to an SLP, get proof of the apraxia, and different things like that. So really all sorts of different time frames, but it does take some time. So I feel very bad for parents and families. So I wish that they could just come in and then we could get them settled.
Okay, so I just want to know that, just clarify this thing to me. If those parents take diagnosis from some other place, diagnosis from their native places, for example, if somebody want to have these services whichever you are talking about, and somebody take diagnosis from their own country, is it acceptable in your country? Are they going to accept that, or they have to follow the procedure of your own country?
So I want to make sure that I'm also understanding correctly. So you're saying if a family comes to the U.S. and they have existing documentation
Exactly.
of a disability, and are we talking about in the public school setting? Like in a school setting?
In a school setting, usual school setting. Like for example, they have to take these all the codes, but they have to have some kind of, you're saying that they have to have some kind of assessment. After that, you are going to get these services.
Okay, so in my experience, a child enrolls at their new school in the U.S.
Okay.
And when the family does not bring documentation of an existing disability. It can be difficult for the school, and it can take time for the school to discern if it's a disability or if it's a language barrier.
Okay.
So it's very important to bring your existing documentation.
Okay.
So earlier we mentioned that if you have an independent education evaluation, you can bring it to the table.
Okay.
So what we didn't talk about was that a school can accept or deny
Exactly.
that information still. Okay. So when a child enrolls in school, the family should immediately request an IEP evaluation. And those documents would then be provided of the existing disability. And then, just like every American child, that family would then start the IEP timeline. And we skipped over those, so I'm sorry that we did that. We should not have in this setting. Now I see. So when you, Jordan, do you want to go back to those slides for a second?
Just let me share my screen.
So when you request a meeting, it kind of varies from state to state. But in general, you have about, I think it's typically about 5 business days to schedule a meeting.
Okay.
Right, Jordan? Is that pretty accurate? I think it's 5 days to schedule a meeting, okay? So then,
Mindless.
yeah. And then in that timeline, you're going to meet for an initial evaluation, okay? So you're going to sit at the table. There's going to be a general educator, a special educator, the parents, typically anybody that that has the specialty that you might be discussing about your child. So if it's apraxia, there would be a speech language pathologist. And then you're going to they're going to talk about whether or not the school wants to evaluate. Okay, so let's say they say, okay, you have this existing documentation, we're going to do an evaluation now. Then the parents would sign consent. Okay. So from the time that the consent is signed, the school has 60 days to complete the evaluation. In that time, a good school would put some interventions in place and some supports in place, especially for an English language learner. And so those would be questions that you can ask, okay, while we're waiting for this to be done, what's going to take place now? What's going to do to help my child now? So then you meet after the 60-day mark. It doesn't always take 60 days, but that's how long they have to do it. And the other tricky part is from state to state, that 60 days could mean business days or calendar days, okay? So you've gone the 60 days, you come back to the table, and they tell you, okay, we've looked at your evaluations, we've done our own evaluations, and we've decided that this is a child with a disability, and we're going to write an IEP. Now the school has 30 more days to get it. That date becomes the annual meeting that you meet on in the future, which we also talked about. You don't have to wait. So by legalities purposes, the schools have about 90 to 120 days from start to finish to get services in place.
Okay. Thank you so much.
There's also different policies for if you're bringing an existing IEP plan.
Okay.
Okay. And then the school can also, once again, they would look at that. They can accept or reject, or they could put some provisions in place while they're figuring out how to transfer that over, because likely what's coming from another country is not going to necessarily match up to what the process and supports are here.
Exactly. And I think that is going to save some time for those parents. instead of just rushing into immigration process. And I think Jordan said very rightly that they can ask prior things. So thank you so much for the response, because parents are always worried, because they say we came to this country just because of our child, and our child is held back and we don't know what to do about that. So thank you so much for your answer.
Yeah, absolutely.